Think of your heart as a powerful pump, working tirelessly to circulate blood throughout your body. This incredible organ, no larger than your fist, beats approximately 100,000 times a day, ensuring that every cell receives the oxygen and nutrients it needs to function. It's a marvel of biological engineering, operating with precision and consistency. With each beat, it makes a distinct sound, the familiar lub-dub we often hear. This sound is more than just a rhythmic noise. It is a vital indicator of our health. The lub-dub is created by the closing of the heart valves, a crucial part of the heart's function. These sounds, while seemingly simple, tell a fascinating story about your heart's health. Doctors can detect abnormalities and diagnose conditions just by listening to these beats. Each variation, each subtle change, can provide critical information about the state of your cardiovascular system. They are the result of blood flowing through the heart's chambers and valves, creating vibrations we perceive as sound. The heart's four chambers work in perfect harmony, with the valves ensuring that blood flows in the right direction, preventing backflow and maintaining efficient circulation. Just like a musical instrument, the heart has its own rhythm and melody, providing vital information to those who listen carefully. The heart's symphony is a testament to the complexity and beauty of human life, a constant reminder of the intricate systems that sustain us every moment of every day. The first heart sound, S1, often described as lub, marks the beginning of the heart's pumping cycle. It occurs when the two large valves between the upper and lower chambers of the heart, the mitral valve and tricuspid valve, close. This closure prevents blood from flowing backward as the heart contracts, ensuring a forward flow. Following the lub, there's a brief pause, and then we hear the second heart sound, S2, or the dub. This sound signals the end of the heart's contraction phase. It happens when the aortic valve and pulmonary valve, which control blood flow out of the heart to the body and lungs, snap shut. Like the lub sound, this closure is crucial for maintaining proper blood circulation. Section 4. Beyond lub-dub, a glimpse at S3 and S4. While lub-dub are the most prominent heart sounds, there are also fainter sounds, S3 and S4, that can sometimes be heard. S3, often described as a low-pitched thud, can occur in some healthy individuals, particularly young adults. However, in certain cases, it might indicate an underlying heart condition. S4 is even more subtle and is usually associated with specific heart problems. Section 5. Heart sounds as clues, a doctor's diagnostic tool. Listening to heart sounds is an essential part of any medical examination. It is one of the first steps a doctor takes to assess the health of a patient's heart. The stethoscope, a simple yet powerful instrument, allows doctors to hear the intricate symphony of the heart. By using a stethoscope, doctors can detect subtle changes in the heart's rhythm and sounds, providing valuable information about its function. These sounds can reveal a lot about the heart's condition, from the regularity of its beats to the presence of murmurs or other abnormalities. Variations in the timing, intensity, or presence of extra sounds can all point toward potential heart issues. For instance, a whooshing sound might indicate a valve problem, while irregular beats could suggest arrhythmia. Each sound is a clue that helps piece together the overall picture of heart health. This makes listening to heart sounds a powerful tool for early diagnosis and treatment of heart conditions. Early detection can lead to more effective treatment plans and better outcomes for patients. By catching issues early, doctors can intervene before more serious problems develop, making the stethoscope an indispensable tool in modern medicine. Section 6. Listening for a healthy heart. Understanding the basics of heart sounds empowers us to be more aware of our own heart health. The heart, a vital organ, produces distinct sounds that can indicate its condition. These sounds, often described as lub-dub, are the heart valves opening and closing. By learning to recognize these sounds, we can better understand what is normal for us. While self-diagnosis is never recommended, being attuned to our body's signals can be beneficial. For instance, a sudden change in the rhythm or intensity of heartbeats might be a sign to seek medical advice. It's important to remember that our heart communicates with us, and paying attention can make a significant difference. If you notice any unusual sounds or changes in your heartbeat, it's always best to consult a medical professional. Early detection of potential issues can lead to more effective treatments and better outcomes. Don't hesitate to reach out to your healthcare provider if something feels off. Regular checkups and maintaining a healthy lifestyle are crucial for keeping your heart beating strong and ensuring its symphony plays on. Incorporate activities like regular exercise, a balanced diet, and stress management into your routine. These habits not only support heart health, but also contribute to overall well-being. Remember, a healthy heart is the key to a vibrant life.